On Monday, she was cooking. On Tuesday, she couldn't move her right hand. Nobody saw it coming, but her body gave her warnings. She ignored them. Have you ever brushed off a moment of weakness or blurred vision? You told yourself, "I'm just tired." But what if that was your brain asking for help? Hi, I'm Euphemia. Today, we're understanding stroke, not to frighten you, but to empower you with clear, medical knowledge. Because it doesn't always look dramatic. Sometimes it starts quietly, a slight weakness, a change in speech, or a brief loss of balance. Inside the brain, something serious may already be happening. When brain cells lose oxygen, they die within minutes. In this video, I'll explain the 5 warning signs and why responding correctly saves lives. One small piece of information could protect you or someone you love. If you value clear health information, make sure to subscribe to this channel. My goal is simple, to help you understand your body before it sends you into an emergency. Let's begin. Now, let's start with the first warning sign. Sudden weakness on one side of the body. Not tiredness, not normal fatigue. I'm talking about weakness that feels unusual, different. Maybe you try to lift your phone and your grip feels strange. Maybe your arm feels heavy, like it doesn't fully belong to you. Maybe when you walk, one leg feels slightly unstable. And because it is not painful, most people ignore it. But here is what may be happening inside your brain. The brain controls movements through an area called the motor cortex. Each side of your brain controls the opposite side of your body. So if blood flow is reduced to the left side of your brain, the right side of your body may suddenly feel weak. This happens because brain cells are not receiving enough oxygen. And without oxygen, those cells begin to shut down. At first, it may be mild. You can still move, talk, and function. But something feels off. And that off feeling is important. Sometimes the weakness lasts only a few minutes and goes away. But medically, that can be a transient ischemic attack, a temporary blockage of blood flow. It's often described as a mini stroke. And it is a warning sign. A warning that a bigger stroke could happen soon. Timing matters. The earlier treatment begins, the more brain tissue can be saved. If you ever experience sudden weakness, even briefly, take it seriously. Your body rarely sends random signals. There is usually a reason. And when it comes to the brain, timing matters. So if you ever experience sudden weakness on one side, even briefly, take it seriously. Now let's talk about the second warning sign, changes in speech. This one is very important and very commonly ignored. Sometimes it starts subtly. You're talking, but your words don't come out clearly. Maybe your speech sounds slightly slurred. Maybe people ask you to repeat yourself. Or maybe, and this is very important, you know what you want to say, but the words don't come out correctly. You pause. You struggle. You feel frustrated. Inside the brain, speech is controlled mainly in the left hemisphere, in areas responsible for language processing and word formation. If blood flow is interrupted in that area, communication becomes difficult. One moment you are speaking normally, the next moment something feels wrong. Some people laugh it off. They say, I'm just tired. Or maybe I didn't sleep well. But sudden speech difficulty is not normal fatigue. It is a neurological signal. Even confusion can be a warning sign. If someone suddenly cannot answer simple questions, looks confused, says things that don't make sense, cannot understand what you are saying, that is not something to ignore. Because when the brain is not receiving enough oxygen, language and comprehension are often affected very quickly. Sometimes the person is aware something is wrong. Sometimes they're not. That is why people around them must pay attention. Speech changes are one of the fastest and clearest signs of stroke. And just like weakness, even if it improves after a few minutes, it still requires urgent medical attention. Because the brain does not send warnings for no reason.